So I'm going to be doing a video today on the V60 Bipap machine that's used here at Avera for my clinical site. Anytime you want to use the Bipap, you want to make sure that it is plugged into the red outlet so that it's hooked up to the backup generator should the electricity go out. So before we get started, I'm just going to kind of go over some of the things that you will see on this particular type of Bipap setup. So you do set up this Bipap to oxygen. You can always hook it up to wall oxygen if you have that available, but then there is also two E-cylinders with gauge and with pressure gauge and manometer, flow meter on there, so that you can use these if you have transport or anything like that. You can just hook this short one right up there to oxygen. I am not going to hook us up to oxygen just for the purpose of this video, but just so everybody's aware that it is hooked up to oxygen on a regular basis. So this is the user interface portion of the Bipap, and so once we go through all of the other external features, we'll turn that on and I'll show you how to change your settings. So if we look here, this is what's responsible for the pressure, and then we have this Bipap set up for heated humidity. So this corrugated tubing, I don't know if you can tell for sure, but it goes to this Fisher-Paykel heated system. So with this type of situation, right here we have this little spike. Sorry, little spike here, and then we're going to spike the bag, and we use sterile water for inhalation. So we'll spike that bag, that'll get hung up here on the top, so that is going to fill up, our system here, and this just attaches easily. You can just slide it in and slide it out using this type of system. So this is attached, you can kind of see that goes right there. Then this piece, it has the temperature probe on it. This is what's going to attach to our patient interface. So you can kind of see in this tubing that there is those coiled wires because it is a heated circuit. So we have the temperature probe here where it's leaving the system, and then we also have a temperature probe right up here, and that's what's going to the patient. So this top piece you're going to see, that will be what's going to go to the patient through the mask, and then this right here is an exhalation valve. So I'll go ahead and attach my test lung. So I'm going to go ahead and attach my test lung here to my patient circuit, and then we'll go ahead and use we'll go ahead and turn it on using the interface. So to do that, what we're going to do is just go ahead and push the power button, and then the screen will turn on. So my alarms are telling me right now that I don't have oxygen available, which we know because I did not put oxygen on. So so down here you can see the settings that you're allowed to change. So you can change your IPAP, your respiratory rate, your inspiratory time, your rise time, your ramp time, and then your EPAP and your oxygen. So your IPAP, that's usually from 6 to 20 centimeters of water. And your respiratory rate, you want 8 to 12, or 8 to 20, or 12 to 20. Inspiratory time can be 0.8 to 1.2 seconds. Then you have the ramp time, which is how fast your patient's going to get to IPAP. That's based on their comfort. Your EPAP is usually 4 to 15 centimeters of water pressure, and you want to make sure that you have a pressure support between your IPAP and EPAP of at least 4. And then you can also do, you can set the FiO2 anywhere between room air at 21% and 100% oxygen. So as you can see, this is showing us our pressures and our volumes, and then we are able to change these. So we could have our make that 9. pick one. We'll do one. And we're gonna get this person, we'll just say 40% oxygen. So this machine also can be in CPAP mode or ABAP mode, but I do kind of want to show you what it looks like in BiPAP mode. So I don't know if you'll be able to tell for sure, but maybe you can hear it. So when we're in inspiratory and expiratory, you can kind of see that the volume does change on that lung. There you go. So you can kind of see that. And then also we can change the mode, so we can change it to CPAP, which is just one constant pressure, or we can keep it at this batch ST, which is our BiPAP, spontaneous in time. And this machine also has ABAPS mode. So this is how you would use this V60 BiPAP machine.